Mohs surgery is a very specialized kind of skin cancer surgery technique. It was originally developed by Dr. Frederick Mohs back in the 1930s, but obviously it's gone through a lot of evolution since that time. The basic premise of it is to take as narrow a margin as possible initially around the skin cancer, but instead of sending the tissue off to the lab and waiting, 4 or 5 days for the results to come back, as you typically would, with a biopsy or a regular excision, we actually take the tissue to the lab and process it and look at it under the microscope within about half an hour to 45 minutes while you wait in the room. And we're able to process it in such a way that the Mohs surgeon is able to look at 100% of the edges all the way around the outside and at the base to make sure that the cancer is all gone. If it isn't gone, so if the cancer goes to one of the margins, we have it mapped out like a clock face, and we're able to go back to the original site and take a little bit more skin, but do it only where it's positive and leave the healthy skin where it belongs on the person's body. So it's a tissue sparing technique, so it has the highest cure rates of any type of skin cancer surgery. 99% for basal cell carcinoma, which is the most common type of skin cancer, and 98% for squamous cell carcinoma, which is the second most common type. Once the skin cancer is cleared, that's part one. Part two is to fix the defect that was created to get rid of the skin cancer. Most surgery is performed primarily on the face because that's where most skin cancers occur. About 70 to 80% of skin cancers are on the head and neck, which is also an area that is important for tissue sparing. Other areas where it's important to spare tissue are on the backs of the hands, because again, there isn't a lot of extra tissue there to spare. On the feet, on the shin bone area, and then in the genitalia. Most Mohs surgeons have done a complete dermatology residency, after which they become board certified in dermatology, and then they complete a 1 to 2 year fellowship in which they subspecialize in this particular type of surgery. There are multiple requirements for the fellowship, such as having a certain number of cases that you've performed or been the primary surgeon on, as well as dealing with complex or rare skin cancers and complex reconstruction techniques. The procedure itself is performed under local anesthesia. They're not asleep during the procedure. The day itself typically, on average, lasts about 2 to 3 hours. Many of our patients are on some type of blood thinner. I would never personally have them stop the blood thinner before, and that's the general recommendation from our American College of Mohs Surgery. Recovery is usually pretty straightforward. We'll put what's called a pressure bandage on afterwards, and that's just to maintain pressure on the surgical site for the next 24 to 48 hours, just to decrease the risk of bleeding afterwards. After that, we just have our patients change the bandage once a day. They're washing with a very gentle soap, putting a new bandage on. While the sutures are in, though, we usually want people to take it pretty easy. No heavy lifting, no vigorous exercise. We don't want their blood pressure to shoot up really quickly, increase the risk that they might bleed into the surgical site as it's still healing. And then once we see them back and remove the sutures, then they're free to go about their usual activities.